welcome back to our breakfast interview. Today we want to look at the ongoing threats to the medical or healthcare services in this country occasioned by the departure or reported resignations of medical doctors from county hospitals, if I may so call them. We are joined today by the Dr. Sultani Matendechero from the Kenya Medical Practitioners and Dentists Union, right?
Yeah.
And of course, Muteginjao, my colleague. Daktari, why are doctors resigning?
Okay. The obvious thing here is that the working environment within the public hospitals has become very hostile to the doctor, so that it becomes impossible for them to continue carrying out duties within that environment. And as a union, we have become concerned because, you know, in this kind of practice, we are looking at the numbers, the absolute numbers that are there, which have been very low. And now with these resignations, which are quite high, we are actually now seeing a situation where we are coming from bad to worse. So we have tried to talk to the doctors. In the last few days, we have been even coming up with a database, because now we want to establish exactly how many are resigning from which part of the from the country, which county, how many are leaving, so that we can even be able to come up with the analysis of the
So
situation.
the figure is not clear yet. 200.
No, we have an estimate.
It's been said
We already have an estimate, but we are worried that even the estimate is very low. So instead of quoting low estimates, we want to now work with the accurate figures.
So what is the estimate?
Already we are having more than, way more than 100 or near 200 in the database that we have established. We are expecting to collect even more in the coming few days. By the time we are done with the database, we expect to have much higher numbers. We have been talking to the doctors who are involved, who are concerned. And they have described to us varied reasons which are driving them into resigning. And they are ranging from things like threats and intimidation from the county officials, because there is this funny notion that there is a war. I think last year when we were talking about some of the dangers of devolving healthcare without laws, without policies, in a haphazard manner, so I think some of the county people thought that now it was a war between the doctors and the county officials. So now they are trying to create a situation where they want to establish dominance over the doctors. So they come and threaten them in the workplace.
What is this contest about? What do you mean dominance? I mean, the doctor is in a hospital serving you know, patients. The doctor is under the county health executive. Where is the problem with that?
I don't understand what
or a doctor, or don't doctors want to be under the county administration?
Okay, I think that one now is besides the point, because when somebody comes and starts threatening you, telling you, now you know you are under me and you will do what I want you to do, otherwise you're going to face a lot of problems and things like that, it tends to start rubbing, you know, these professionals wrongly. Yeah, we have seen situations like micromanagement. You know, it gets to as bad as that, where now these officials are coming to the hospital and then they start even telling the doctors what to do. So now the doctors start wondering, you know, in my training, this kind of work, it is designed in such a way that I am supposed to establish who I should see first, so that in terms of emergency, I can be able to see the other one later. But somebody comes and tells you, now you are seeing people who are coming from outside the county, and yet this is our hospital, so you will see first of all our people here before you can be able to see others. You know, now they interfere even with your professional kind of arrangement, the way you want to do your work, which is not something that professionals will take very easily. And it is a big range of things. We have seen ethnicization, yeah, of the workforce, such that even now things like training, which are now, we are not very sure whether it is the county which is supposed to handle or the national government. So you find now the counties are telling doctors that if you are coming from outside this county, you should not expect us to use our resources to take you for training. And yet medicine is a field where you have to keep on training, because new things come in every day for professional development. As people specialize, there is supposed to be a scheme which is allowing them to train. So this kind of problem is now being seen in some of the counties. Ethnicization, things like promotion are being based on ethnic grounds, and that is really pushing away most of the doctors. Another thing, maybe if I can just run through them, some of them, because there are so many.
Yes, we want to get the situation, the environment that is clear. Yes.
Yeah, you find that some doctors are talking about a situation where in the hospitals now there are no drugs. Because, you know, in a hospital you need to have a whole range of drugs, because we see a whole range of diseases. So what the governors are doing in some counties, they are going and getting truckloads of maybe 2 or 3 types of cheap medicines. Then they come and flag them off, you see, in front of the media, and then they start saying, okay, now we have bought drugs worth several millions of shillings to be distributed across the whole county, and now all the hospitals have the medication. Now, some of the important types of medication, emergency medicines and so on, are not there. Now, this doctor is charged with the responsibility of seeing patients so that they can be treated and they go home when they are well. But because they don't have the medicines, they don't have the medical supplies, simple things like gloves, protective wear, like even you know, the masks and so on, because we work in a very dangerous environment, they are not able to discharge their duties well. Now, waiting for you is the possibility that when this patient dies, when this patient develops complications, you will now, the system will come for you, accusing you of medical negligence. We have seen a lot of that in the media recently, where doctors are being accused of medical negligence because of things that are beyond their control. Now, it would be very stupid for someone to sit there waiting for that kind of victimization, when in actual sense they are not even supposed, they're not the ones to blame for that kind of condition. So they are now actually moving away to places where they can be provided with the right environment to carry out their job without such dangers. And then obviously, the most important one, the most important thing is now the salaries. And we talked about this quite a lot.
Yes.
We said that these counties, we know they don't have the capacity to actually manage the salaries for health workers. And we even went on strike because of that. We were saying, no, don't hand over the function of salaries to the counties because they cannot manage it. We were told, no, you are just being paranoid, the counties are ready.
Didn't you move with the same salaries that you were enjoying previously?
Now, in fact, even yesterday, and even today morning, I've even started receiving calls already. Yesterday, I was with an officer who had just traveled from the coast to Western Province to look for her salary for 2 months, you know. So I was wondering, she has spent the whole of last week looking for her salary because it was allegedly sent to Kakamega instead of being sent to one of the county where she's working. So she has not been on duty for the whole week last week, yeah. And you know, now when you find that doctors are now spending the whole week on the road looking for salaries, these are the things we were saying. The counties are not ready. Doctors are complaining about their allowances have been slashed. We were told it is just a hiccup in January. Now in February it has become worse. March, there's others who are being told you have been being paid wrongly. Now we are not going to pay you at the end of
This is what I'm asking. Isn't this health ministry function? I mean, doctors were employed. You were deployed to district or whatever hospitals, different level hospitals. Did that change your pay package? That is what we need to know. In my view, it didn't.
Now, actually, when you look at even the laws that have been quoted extensively by especially the officers in government, they actually expressly say that the salary is not supposed to be reduced. Okay? But when you look at what is happening practically on the ground, the salaries have been reduced. So what is happening is that we are just being treated to lip service, being told, no, it's a small hitch, we will organize it, we will work it out. But people are going home with the reduced salaries. People are not being able to manage their obligations, their financial obligations, because effectively they are taking home reduced salaries.
Let me ask
And
you,
that is the problem.
Let me want to understand this.
Yeah.
The health sector is not the only one that has been devolved. The other sectors have been devolved.
Yeah, sure.
Why are there no witches there?
I don't know, because I don't come from the other sectors. I don't really understand what is happening
civil
there.
servants were taken to counties.
Mm-hmm.
And of course, there are various sectors which were devolved. We don't hear much noise about that.
Mm.
Why health?
I don't know about the other sectors much, but I know that there are quite a number of sectors that were devolved. Most of the information I have is from the health sector. However, if they are experiencing the same problems, I'm not aware. I know that we have been carrying the load of most of the civil service. And in fact, I was saying my brother Odege should be giving me some commission for doing most of his work. Because whenever we come out and point out the problems that are affecting our people, it tends to now replicate to the whole civil service. What we are saying is that we don't really understand why there's been a very big hurry to quickly rush, especially salaries of health workers, to the counties when we know that the counties are not able to do it. And what we are seeing now, the missing salaries, the reduced
But
pay,
this could be maybe
the
teething
delays,
problems.
yeah, the delays that have been there. These are things that we
Maybe
talked
the
about.
doctors and health workers are being impatient. Maybe these are teething problems, like a growing child.
In maybe 3-4 months down
Yeah,
the line,
they will
things will normalize.
Okay, I think it is easy for you, Mutegi, to say teething problems 4 months down the line and so on.
Yeah.
When you are the one who is wearing that shoe,
Yes.
you cannot say that. Because when it gets to the point where the landlord is at your door looking for his rent, you will not tell the landlord that it is teething problems.
Yeah,
when you go to the supermarket to buy milk for your children, you will not tell those people at the till that the counties are experiencing some teething problems. Just give me whatever I need, and then once it stabilizes 5 months down the line, I will come and pay.
Okay.
How is the Cabinet Secretary for Health and the Director of Medical Services helping or not helping?
The Cabinet Secretary, I must say, has really been trying to also put this case forward. And since last year, I think even his position has been quite clear that we need to manage this situation so that we don't have hitches, so that we have a smooth transition. As much as we have engaged with the Cabinet Secretary, the Permanent Secretary, the Director of Medical Services, they have been even in the media saying that we need to take time before we can be able to transfer some of these services to the counties. But I think I don't know if it is politics or what it is. This has not been done, and what we have seen is just the rushed transfer of these pay to the counties, and now we are actually seeing the outcome of what we were talking about.
But, you know, doctors are on record as having opposed the devolution of the health function to county levels.
Yeah.
Is that not true? So
Okay.
this seems to be a continuation of your resistance. Somebody would say so.
Okay, first of all, we have to understand exactly what it is that the doctors were talking about. And this has been a position of the doctors' union, and probably by extension most of the health workers. We know that the new constitution, after being passed, there are some functions which were devolved. Healthcare was one of the functions that were devolved, and so we cannot oppose a constitutional provision like that one.
Right.
However, what we have kept on saying, and I have even been pointing out and saying, I do not oppose devolution. What we are opposing is the manner in which it is being done. And that is the point where we depart with most of the people.
Yes.
The people who made the constitution, what they envisaged was that we have different health needs within different areas of the county.
Right.
So when we go back to health, we are looking about the provision that was given. Actually, the function that was given to the counties was primary health care services. It is there in the constitution,
Primary health
in
care.
black and white.
Right.
Now, when you take a provincial general hospital, then you put it under the management of the county. Now, what kind of primary health care is a provincial general hospital providing? Because according to me, I know primary health care is about promotive and preventive services, health services.
Right.
Yeah, but once you are now seeing a situation where you need curative clinical health
but
services.
you know, Dr. I totally agree with your argument. Your argument is very understandable. My question is, are these things not being canvassed, discussed? Are you not being involved in these processes of devolving these functions?
Okay, I really want to be very clear on that one. Last year, one of the biggest problems we had, and we talked about it quite a bit, was lack of involvement. As very important stakeholders, health workers had never been consulted, had never been involved in the process. So when we started coming out and raising the red flag, that's when now we started seeing some kind of involvement. And in fact, I must say that is one of the areas which is being addressed, because even last week, we were involved in the stakeholders forum for validating the health policy. And remember, health policy is something that is supposed to be in place even before we start talking about anything like a devolution of healthcare. We are supposed to